Hi everyone, so it's me here with a piece of saran wrap over my face because I have occluded my numbing cream. Tonight I am going to go ahead and do a demonstration of microneedling. So microneedling is a really cool technique in where we make little tiny perforations in the skin using a device with needles to go in and kind of trick the skin into thinking it's injured in order that it would create a cascade of fibroblasts to go ahead and repair the skin and produce more collagen. So I'm going to be looking into two different lenses tonight because I'm doing both an Instagram and a Facebook Live. This is my first time trying to do both, but there are different viewers on each of these social medias. So let me tell you a little bit about what I've done. I have a numbing cream on my skin. It's been on for about 45 minutes. Like I said, I have occluded it with a piece of saran wrap. That just helps the numbing cream to work a little bit better. So I cleansed the skin. I put the numbing cream, I cleansed it, used a little bit of rubbing alcohol just to sanitize the skin, put a little bit of the numbing cream on, and now I'm removing it with a paper towel. So my face is feeling pretty numb. You numb for about 45 minutes with this treatment. Kind of feels like, my mouth feels like I was just at the dentist and got a little shot of Novocaine. And can I just tell you guys that it is a balmy, like 12 degrees here in Buffalo tonight. So I thought, hey, what better time than now when everyone's sitting at home trying to keep warm to do a nice live video. So I am removing all the numbing cream here with my tissue. Even though it's 12 degrees, I guess the real feel here is like -6. I can tell you that the winds were blowing and it is blizzard-like conditions out there, so my Under Armour on. I didn't have to work today. Took a few days off, which was super cool. All right, so I have removed the numbing cream. Next, like I said, I'm going to go in with just a little swipe of rubbing alcohol. We want the skin to be sanitized. We're going to be perforating the skin here with some needles, so we want to make sure we're nice and clean and sanitized here. Oh my gosh, my mouth is so numb, which is good because I'm going to work my little lines here really hard. So for those of you just joining us, this is going to be a demo of microneedling, also known as collagen induction therapy, fractionated collagen induction therapy. It's very similar to the laser, like the fractionated laser, except you don't have to worry about destroying healthy tissue with this, and there's virtually no downtime. So tomorrow I'm going to look like I have a slight sunburn. I'm going to actually feel like I have a slight sunburn tomorrow, but the rest of it is going to just heal beautifully. So I kind of call this like a no downtime treatment. So first I'm going to be starting with some brand new serums I have here. And the first serum that I'm going to be using is going to have a platelet-rich plasma type effect. If you've ever seen that vampire facial that the Kardashians do, that's because they use platelet-rich plasma. That does require that we draw blood, and it has to go through a centrifuge, and we have to separate out the plasma. I'm not quite set up to do that yet, maybe someday. But in the meantime, this is a serum that is similar to a platelet-rich plasma. So I'm having a little hard time, oh, there we go, with my draw here. I don't know why. Anyway, this particular serum is new to my practice, and I'm just starting to play around with them and see what we get here. So it has to be drawn out with a syringe. Very, very nice because it keeps the serums very active and effective. Okay, so I've just put a little bit in a dish, and I'm going to start up here on the forehead. So what I'm going to do is apply some of this serum to the forehead, and then I'm going to be turning on my device, and occasionally I'm going to probably add a little hyaluronic for slip. So got to put my glasses on. I'm 50 now, so that kind of stinks. This device has different depths, so we're going to be adjusting the depth of the needles based on the areas of the face that I'm treating. So right now I'm going to be going a little bit less depth on the forehead simply because We're so close to the bone. So I'm completely numbed. And there we have 12 needles that are just going up and down, and creating micro perforations in the skin. You can see I'm getting a little bit of redness here. So I'm doing this now for several reasons. I have lost some elasticity. Of course, you know, that comes with age. You know, collagen production slows down a lot as we get older. Ooh, might get a little sneeze here. This does trigger a sneeze once in a while. But mainly I'm doing it because I suffer from bad acne scarring. I started with acne probably when I was about 12 years old. I was cystic for the majority of my life. I did do 2 rounds of Accutane, though I have done a lot to help my clients heal their skin without having to go on Accutane. It's not my first line of defense these days, now knowing what I know. But I have a lot of residual scarring because of the cystic acne. So as you can see here, I'm getting fairly red. I can't really feel a thing. Maybe a slight bit of tingling, but you know, I'm going in 3 directions, vertically, horizontally, and then diagonally. We want to create as many microperforations in the skin as we can. That's where we're going to get that nice trigger of fibroblasts. So just moving on here. And what I do is just go section by section on the skin. I did have my filler done recently by sweet little Jenna Goldsmith. We do have a Botox special going on the month of February, $50 off. You get, bring a friend, you get another $10 off. So essentially that's $60 off. Stay tuned, that email is going to be going out this week. She did my filler in my cheeks. She did it in my tear trough. She did it in the actual mouth area here. And like I said, these are needles. I'm going to go ahead and just kind of adjust the depth here. I'm getting into a little bit of a fleshier part of my face. I'm going to go ahead and get that a little bit deeper. You may see some pinpoint bleeding begin. Totally fine. We actually like a little bit of pinpoint bleeding. So you can see it's just a very meticulous kind of going over the skin in 3 different ways. Vertically, horizontally, and then diagonally. So I've increased the depth into this more fleshier part of the skin here. I have to draw out just a bit more serum. Wouldn't you know, I had to get a needle that's kind of not drawing the serum as well. Oh, there we go. So again, just section by section here. Now this is the area of my face where I happen to have a lot of scarring. It has really kind of driven me crazy my entire life. So after I go in with the 3 directions on this area of my face, I'm not going to keep you guys here for the whole entire treatment. But after I do this section of my face, vertically, horizontally, diagonally, I'm going to go in with a stamping motion. I'm going to really increase the depth of the needles here when I do that. Ouch, guess I didn't get the numbing cream far enough over here. Ooh, that hurt. And when I go in with a stamping motion, I'm going to really hit up some of those boxcar scars that I have. You know, those really square looking scars, those pitted scars that you get from acne. So yep, this is crazy because these are needles. Actual needles. So I'm going in again here, and oh, I don't know if I mentioned that this serum has a little bit of hyaluronic already in it. And some growth factors. Growth factors are going to be what is predominantly responsible for tightening the skin. So the laxity that we start to experience in the skin as we age. Right here in this jawline here, I did have a little filler put in there, but I'm thinking I'm going to have to get Jenna to put a little bit more in. It's driving me crazy. Alright, so there we have the horizontal. Go ahead and get a little more serum here. I just draw out the serum as needed as to not waste the serum. Now I'm going to go vertically. So as I mentioned, this is really a nice treatment for people who are not candidates for laser. People who would not be candidates for laser usually are people of what we call a higher Fitzpatrick type. Fitzpatrick type means the color of your skin. So, you know, if you're Mediterranean, African American, Hispanic, Indian, a lot of times you are not a candidate for most lasers. I'm not going to say all lasers because there are some lasers out there that you can do on higher Fitzpatrick types. But this is awesome because if you are not a candidate, guess what? You can get similar results with fractionated collagen induction therapy as you can with fractionated lasers. I worked in a med spa, so I know a little bit about it, and I've had quite a few lasers done. I'm kind of over the lasers personally myself. I'm over them on my own skin. I just did so many of them, and just kind of what I've learned now about lasers, I'm going to try and preserve as much of my healthy skin cells and tissues as I can as I get older and the skin starts to thin out a bit. Let me just tell you, the lip hurts. I don't care how much numbing cream you have right now. This is going to make my eyes water just a little bit. Again, we got about 12 needles. I think this is a 12-pin head here, and go in here. A lot of people get those lip lines if you were a smoker or drink a lot out of straws. You know the lines that I'm talking about up in here. They drive me crazy, so ouch. I'm not gonna lie, people, this part hurts. As close as I think I got to the lip, I didn't. Ouch, ouch, ouch. So, alright, pretty red, not red. This is what you can expect from microneedling. You look like hell the day I do it. You're definitely not going anywhere the day we do this. Go home, relax, sit on the couch, get a book. But the next day it'll look like a slight windburn to the skin, just slight sunburn. And as the days go on and progress, you're going to feel a little bit of itchiness because that's the skin actually healing. That's completely normal as well. You're going to use a little bit of the growth factor serums in the days to come. So I'm going to add a little bit more serum here. I'm going to go into this area where I told you I have some significant acne scarring. And then I just go over those spots, and I'm just going to go ahead and do a little stamping motion, in and out, in and out, in and out. All right, 12 needles, thousands of pinpricks in the face. I've increased the depth here because with acne scarring we can get this to penetrate just a little deeper. Let's trigger that cascade of fibroblasts. Let's start triggering new collagen production. You're going to want to do this in a series, and results are fully realized after about 6 months. So this is not an instant gratification treatment, though you will see some nice changes in the skin. This is not instant gratification like some of my other treatments. If you don't like needles, you'll love my Regenerate. That's a nanosilicon technology, so it's no numbing needed. I'm hating doing this right now, people. I am so hating this feeling right now on my lips. Ooh. No pain, no gain. Okay. So, microneedling, also known as fractionated collagen induction therapy, using a platelet-rich plasma-like serum for the face. This is going to also have some growth factors, some peptides. Everything you need for healthier skin cells is in these serums that I'm using. Hyaluronic acid is what's used in dermal fillers. That's what's going to be very plumping for the skin. That's what girls put in their lips when they have these big lips. That's hyaluronic acid. But this is a treatment for you if you are looking to start an age management program, get rid of some fine lines and wrinkles, or start to soften up some of the acne scarring. So get a hold of us, www.belvisoskinstudio.com or belvisoskinstudio@gmail.com, and reach out to us. We have packages available. This is a great time to do this when you're kind of hibernating in the 716 for the winter, and we will customize some pricing for you. So thanks for tuning in. See you guys soon. Bye-bye.